Hi everybody, Wynn Brown here with my bi-weekly President's Update. I have Darren Bono, the relatively new Director of Cardiology and Radiology for Heywood Healthcare with me today. Welcome. Thank you. So why don't you tell folks a little bit about what's going on in radiology and your role, because you're a relatively new face to everybody.
So I've been here a little over 3 months now, and it's a great culture. I've really been impressed with everything that's happened. We just opened a new radiology department at the Athol campus, and staff are very excited. We're doing a lot of hard work for patient experience, satisfaction here at Heywood Hospital and Athol Hospital, and I think things are going very well. So
I hear great things with radiology, and I know that the move into the new radiology suite earlier this month at Athol went very smooth, which is in the old ER space that we renovated. That's why that project wasn't done at the same time as the new Hillis building went online. But what's in the new radiology department?
the new radiology department, it's a little smaller than Heywood's department, but we do have X-ray with brand new direct radiography, which is new technology that allows for less radiation to be delivered to the patient, along with expediting the process so that we can get the results faster.
Oh, great.
And we also have mammography, we have bone density, and we have ultrasound, and we also have CT services right next to the emergency room. So it's a great new modern department. The patients are very, very happy with it. I've heard a lot of positive comments. Staff are, I think I mentioned, are very excited, and it's a brand new place for them to work, and just
Big change.
it is.
And I think our CT, we just started doing some new studies there that we hadn't done before.
Yes, we did. In fact, we are doing calcium score cases now, which is a preventative way to screen for coronary artery disease in a patient. They call it the mammogram of the heart, and it's a very simple process. You go in, we actually hook the patient up to an EKG. You go in, it's a 10-minute process. You go into the CT scanner, and that's it.
No, it's fantastic. I've had one. I've had one done.
I have too.
So it's a very quick, and it's $99. I think is our pricing for that.
$99 for that.
And so it's a great gift. I've actually given a gift to someone who actually turned out that they did have a major blockage and ended up needing to go down for an interventional procedure. So great opportunity now with a better, newer, faster CT at Athol to be able to do that. And I think though there's one last move for radiology, which is the MRI.
That's right. So MRI is the last phase for Athol's Hospital, and just getting that situated. Right now, we are expecting that it will go live by the end of March, so this month. And once that happens, we'll be able to offer that service within that new radiology area that we have open now next to the ED.
So to be clear, we have always had MRI services, but we're moving the mobile unit around the corner adjacent. So that's great. So can you just tell us a little bit about the culture work that you're doing? I noticed you have a new newsletter out for your department.
We do. We decided to put a new newsletter out and really focus on building the communication throughout not only just our department here in Heywood, but the Athol department, and also the urgent cares that we have. Our goal is to really just combine the message that's being sent to all of the imaging departments throughout Heywood Healthcare. And I think that's what the teams want. I think we need to increase the communication and send one message, and I think that's what we're
A lot like what we're doing with the heart training as well.
That's right.
So that said, I know we've talked a lot about going on Athol, but I think we are demoing a lot of new equipment. I know that we have ordered our new 3D mammo for the Heywood campus, but I think there's a couple other big pieces of equipment that are slated to be ordered this spring as well.
Right. The plan right now, and we're looking into not only the 3D mammography, which we are hoping to have up and running by the beginning of the spring, but also some new ultrasound equipment, a new C-arm for the Heywood campus, and we're actually starting to look into DR, direct radiography, for the Heywood campus for the next fiscal year.
So a lot to go, and we we have great equipment, but we have to keep upgrading it and changing it, and I know that especially around ultrasound, we're working hard to get that done to make sure we have really state-of-the-art equipment there.
Definitely, and consistency
Within the departments. So do you have any questions for me, since you're my co-host today?
Well, I did miss the winter affair.
You
and
did.
So I was hoping you could share with me how it went, and for all those who couldn't attend.
So we had a great winter affair. We had 315 guests at the Colonial Hotel, which really maxes out that facility. And that is focused, this year was called Beyond the Backpack, and it was looking at all the things we do in the community for youth and helping fund those. And so I think it was, we had dueling pianos again, which was a great time. And so it really, I think, a great event for the community. And so if you want to, next year it'll probably be bigger and better as well. And so it was a good time, and so next year hopefully you'll make it.
I hope to be there.
Yeah.
The other thing that's been coming up is just the current events that are being a hot topic, and I was hoping you could just share some information on Friday's town meeting.
So we had town meetings on Friday in the morning for the medical staff, and in the afternoon or mid-morning for staff around the coronavirus, and update with Dr. Mahan, our infectious disease specialist, just making sure everybody has the most current information. Information and knowledge grows and changes every day, as does the progression of the disease throughout the world, and in our slice of the world, which is Massachusetts. So just trying to make sure everybody has their questions answered, they know what is going on. Obviously, our intranet site is updated regularly with links to the CDC and to the state. We have now, beginning today, we've implemented a daily huddle around coronavirus. There's been regular meetings around coronavirus, and there's one today at 4 o'clock. But we putting that right on the tail end of the huddle on the Heywood campus, and we'll probably be doing the exact same thing in short order at the Athol campus as well, and probably doing a dial-in as well to make sure that we're all on the same page together. Also in close communication with UMass around what their preparations are as our tertiary support. And so, we are learning, we are making sure that we're up to speed, signage, all sorts of things to make sure that we're prepared. I think one of the nice things is that testing is becoming more readily available. First it was just with the CDC, and then the state now had access to do the testing, and now LabCorp and Quest can do it as well. And so there's a screening process to whether or not that screening tool would be used or not. But it is so. Our biggest concern really is around supplies, because a lot of the supplies and medication and those things are made abroad, and so there are tight controls on supplies. Right now we're okay, but we do not have exhaustive masks and everything, and so Scott at Jansen's is really on top of making sure that we're paying attention to all of that. So right now, so far so good, but we're this is a huge issue for not just our hospital and our community, but everywhere. And so, we're all working together to do the best job we can to be prepared for that. Because it's not a question of if, it's a question of when, most likely, and so we need to be ready.
Very good. Very good. Another question that's come up is, or at least I have, is with Hospital Week coming up, especially for those of us who are new. I was hoping you could just talk about what's happened in the past.
Okay, so traditionally in the past we have celebrated Nurses Week and Hospital Week together because they coincide on the same week. We've also made another change this year to make it an even bigger celebration, is to move our annual employee recognition event, which celebrates 5 years of service, 5, 10, 15, 20 and on, and bring that into this week as well. And by doing that, we can really have a big celebration and put those two events together. We will award our scholarships and awards that we have at that point in time. We're also going to be swagging the whole entire organization as part of our celebration of really our staff engagement scores improving so dramatically. And so coming up shortly, you'll be able to go to either gift shop on both hospital campuses and try on a vest and the jacket and see which one you might want, and then put your order in, and we're going to deliver all of that magically somehow during Hospital Week. And that's for all volunteers, active medical staff, and all staffs. And so a lot of swag gear just to celebrate the great things that are going on at Heywood. So I'm looking forward to that. It's going to be a great week.
Okay. Sounds great.
Yeah. Well, thank you very much for coming in. I
Thank you
appreciate
for
it, the
having
great
me.
job you're doing. Nice to know that you're past the 3-month mark and that you're really enjoying it. And so encourage, maybe we'll have someone from cardiology at another time come join us as well. I'm always looking for a co-host, so if you want to be a co-host, just reach out to my office and we can have you come join us. So thank you very much. Thank you
Happy to
very
be
much,
here. Thank you.
everybody, for all the great work that you're doing at Heywood.